We've got Dr. Afshan Ahmad, who's from one of our newer medical schools, Aston Medical School in Birmingham. She's a lecturer and admissions lead there. It's an absolute privilege and honor to have Dr. Ahmad with us today, and she's going to be going through how COVID-19 has impacted the requirements for work experience. I can see lots of questions in the chat previously about work experience and how COVID has impacted this, and virtual versus in-person work experience. So hopefully Dr. Ahmad will give you a very good insight into this. Dr. Ahmad.
Well, thank you very much, Imran. You said you're privileged to have me. I think I'm the privileged one here. It's lovely to share a platform with such amazing people who've achieved so much in their lives and who are doing so much to help others. So welcome, everybody. Now, normally I'm used to looking at all of you young people, looking at, you know, the excitement in your eyes. And I feel so sort of excited by all of you. You're setting off on your journeys in life, and you've got all that, you know, all that competency, all that ability. And I know that you are going to change the world for the better. You will be the innovators of tomorrow. You will be the leaders. You will be the doctors who patients want them to hold their hands when they're passing away. You will be those amazing people that we all look up to and that we all hold as an example for future generations. So welcome to all of you. Now I'm going to talk about work experience. So I've tried to make this talk as general as possible, because although I can let you know what Aston is looking for and what we will accept, I think it's really important on a platform such as this to give you a general feel for what is out there, what is expected of you. And then obviously, if you want to go to individual medical schools to look up what their requirements are, then we can have a look at that, okay? So I'm going to share my screen, and I've got a presentation here. Right, can you do let me know when you can see it? Yeah. Can you see that?
That's absolutely fine, yes.
Great, I shall increase that in size so that we can all see it better. Right, there we are. Now I struggle with IT, so that's my first achievement of today, to have shared my screen. So before I start, let me tell you, we are all aware as medical schools and as admissions people that it's really difficult for young people to get any kind of work experience now because of COVID, because of distancing, because of all the other things that have come into play. Okay, so let me tell you, why is work experience important? Why do we expect you to have some degree of work experience? And this is because it's your chance to experience what it would be like when you're actually in that job, what it's like, you know, when you're actually doing the job, looking at the good points as well as the bad points. And doing work experience gives you the opportunity to talk to people who are actually doing the career that you are thinking about. So for example, you know, if you obviously are interested in medicine, if you do a work experience in a hospital environment or a GP environment, it shows you what that job is all about, how doctors work with other people, the demands, you know, the stresses of day-to-day practice of that career. So it's to give you a really balanced view, not just a romantic view that we get on television, you know, when you see these doctors dropping down from helicopters, rescuing people on the mountainside and getting all the best girls and boys. This is about the nitty-gritty of everyday life, which can be exciting, but majority of it can be actually quite boring as well. So for example, in your earlier years, you might be asked to take history, take a history. So, one after the other. So after a while, it becomes mundane. You may have to take bloods, that becomes mundane. So, it's to give you a real good feel for everything that goes into that career. Also a chance to actually look at the workplace, the environment, how everybody works together. And that hopefully is then going to give you the information you need to make an informed choice, because it's really important when you're considering medicine that you know what you are letting yourself in for. It is a very long study time. So, 5 to 6 years of studying. Then you've got 2 years of your foundation years of training, further training, clinical training, and then you can think about specialty. So you're already 8 years into studying before you can think of, well, do I want to be a GP? Do I want to be a surgeon? So it's that kind of thing that you really need to be clear about. And work experience is the pivot that enables you to gather all of that information, okay? And also the work experience is something that you write about in your personal statement. And it's how you relate the things you've observed, the things you've experienced, to the qualities that are needed to be a good doctor. And this is contained in the General Medical Council's sort of documents, one of which is the Good Medical Practice document. So it lists the duties of a doctor. And these are things like communication skills, empathy, knowledge, safety of your patient. So all of these things that you read about, you will hopefully get from the work experience, and then you can make an informed decision. And a really important thing is reflection. Now, Imran will tell you, and any other medical doctor that you talk to, that reflection is a huge part of medical practice. And reflection is about observing and then saying, well, did I do that right? And if I didn't, how can I do it better? And for you as young people who are, I know that you won't be able to experience face-to-face work experience, but when you go on the online ones, you reflect on what you see exactly the same as you would reflect on what you see in a face-to-face interaction or face-to-face work experience. So watch what the different people are doing, understand how they're interacting, relate it to teamwork, relate it to, that empathy. So all of these things that you would see in a face-to-face interaction on a proper normal work experience, you will be able to experience in the online ones, and you look at it and you reflect exactly the same as you would do in a face-to-face one. Okay, that's a really important point. Now, when I do my PowerPoints, they're very bland. And my children always say, put in pictures. I've tried very hard to put in lots of pictures. So I hope you appreciate that, because it's taken me ages. Right. So the other thing about work experience, which I've said to you at the moment, because we all understand you're not able to get a hands-on experience, we understand that. But when you're deciding on which medical school, can you please go to their websites and check what they say about work experience requirements? Now, for Aston, we don't need you to have any particular type of work experience. As long as you can relate these qualities to yourself in a personal statement, that is fine. But some of the medical schools may require it. So it's really important you check on the medical school websites. Also, some may require health-related work experience, so be careful about that. And also look up the timing, because some medical schools actually say you've got to have a minimum of so many weeks or whatever of work experience. So be careful when you apply for medical schools that you check those tiny things, because you only have 4 choices. So don't waste any of them by not looking at their website relating to everything. I mean, I'm talking about work experience, but do look up how they use their personal statement, what GCSE requirements they have, what A levels they require, okay? Now, Imran, do feel free to stop me if there are any questions coming through, because I don't like to dictate what I'm saying. It's quite nice to have interaction. So stop me as I'm talking. If somebody wants to ask me any questions, I am more than happy to respond, okay? So you will hear a lot about the Medical Schools Council, excuse me, because it's an organization that all of the medical schools belong to, the new and the old and the wonderful and the not so wonderful, although I think we're all wonderful. So it's actually, it lays down what is the purpose, what is the purpose of work experience and why it's important for people who are applying for healthcare associated careers. So it's really to be able to either be in a role or watch a role where somebody is interacting with people who are disabled, disadvantaged, people who are ill, because that is the environment you're going to be in. So become familiar and make sure that is the environment that you'll be comfortable in. And also direct observation in healthcare. So you don't have to be actively doing a surgery to be able to understand what is involved. Watching and reflecting and thinking about it is also really important, okay? Now, obviously, we are in a pandemic that none of us had ever anticipated. And so, as I said at the beginning, we all realize that work experience has literally shrunk to nothing for a lot of young people, because GPs are busy, hospitals are busy, and they can't accommodate, you know, sort of young people, and they can't sort of see what's happening. So, you know, we're all kind of stuck. But actually, the pandemic has brought up new opportunities, and you have to be innovative in the way that you approach your work experience now, okay? So some new opportunities have arisen. So for example, in hospitals, in hospices, you can ask them if there is any administrative work, because administrative work is still going on. So you can ask if you can do administrative work there. You can actually still work in care homes as a volunteer. Now that, you know, we've got popping up all over the place vaccination sites. You can ask to be a volunteer there. You've got testing sites for the COVID virus, so you can be volunteer or you can get a job in those sites. You've got lab work because, you know, as you can see, let me just check my timing. Yeah, fine. As you can see, so in terms of laboratory work, it has exploded, because can you imagine how many COVID tests have to be done? They are into the hundreds of thousands. So we have got out there new things that have come up that will now provide opportunity for work experience. So explore those. You know, I've put this list up for you to have a think about, because I think all of us have all of a sudden thought, oh dear, COVID, all work experience through the window. Yes, to some extent, but look at the opportunities that it has created. You know, there are many things happening. And lots of people I know, lots of young people have actually even been able to help with the test and trace system. They've also been delivering kits to the doors of people. So, you know, those kind of things are lots of opportunities for you to get involved. And you know, last but not least are these food banks. So, you know, we've got lots of food banks popping up all over the place, because our vulnerable people have lost their jobs. They're not able to, you know, find money to kind of look after their kids, feed themselves. And we've got lots of food banks. So you can volunteer in food banks. You can literally volunteer to bag the food, and you can reflect on that. You can reflect on the effect of a pandemic that comes down through the population, and that, you know, provides so much disadvantage to so many people. And again, think about the experience. The experience is the key thing. It isn't the kind of experience. I mean, you could literally, honestly, work in a, say, for example, you were working in a food bank, filling bags, okay? You can talk about that. You can say, in the pandemic, I thought it's really important that I get some kind of hands-on experience, couldn't get it in healthcare settings. And, I realized so many food banks are popping up. I volunteered with a food bank. And by working there, I dealt with people. When we were filling in bags, I had to deal with people, work out what goes in each bag. I had to then tot up how many bags we'd done, how many bags were needed. So I was problem solving. I also organized how we were going to deliver it to those who were vulnerable. So thinking about vulnerable people, compassion, empathy, understanding of their situation. So can you see from a little role that you think, oh, I've only helped in a food bank, you can talk about it like an essay that takes 10 pages by reflecting on it and saying, I had to have good communication skills because I had to talk to everybody. I dealt with the general population when I was delivering to the people. Some of them complained, so I'm now used to dealing with complaints. Some of them were upset. And I had to talk to them, so I know how to communicate. So can you see, it's the way you use your work experience. And that word work experience to everybody means working in a hospital, shadowing brain surgeons, or following a GP around and doing all of this. Yes, you can watch that online now, but reflect on it. And then you can relate simple things that we think are not significant to that. Even in your school, I mean, you might be helping out with younger people who are a bit stressed. That is, you can put that is work experience, and you can put that down. Okay. Right. So online resources. Now, obviously, I've highlighted on the previous slide the list of opportunities that have opened up. And you have to be innovative. You have to go a little bit out of your comfort zone and explore all of these as possible work experiences. And that in itself says a lot about you, doesn't it? That if you've thought about it, if you've explored everything out there, and you've come up with some things that are going to be really helpful to you in exploring those qualities, in being able to talk about those qualities, great, absolutely great. Okay. Right, so online resources, there are a lot of online resources out there on work experience. So I'm going to talk about two main ones, which are really important, because when you go online, there's an explosion of knowledge at the moment, isn't there? But the important thing is that you select those resources properly, okay? So I'm going to, further slides show you the kind of two that are really important online resources at the moment. But online resources give you a view about, you can experience what surgeons do, what GPs do, pediatricians, all kinds of specialties. And again, reflect, look at what they're doing, see how they're interacting, see what skills they're using in that particular specialty, okay? And think about it, and think about how you can put that down on your personal statement. What things have you taken from watching these online things? So one of a really good resource is Brighton and Sussex Medical School's online work experience, okay? And they kind of give you an overall view of the NHS, and then they've got different specialties that they've got resources for. So you can watch, you can experience all of these different specialties, which kind of, obviously there are, absolutely loads more specialties in medicine than this, but it's kind of key areas that give you a kind of an idea of what different specialties are all about. So again, reflect on what you're watching. And also look, one of the things you can talk about is that, you can say, oh, because I couldn't get any live work experience, I did a lot of online work experience. And the one thing I noticed was how, doctors don't just sort of work on their own. They actually work with teams. They're part of a multidisciplinary team. And that you can refer to. You can say, when I was watching this online resource, I could see that. And that was really something that jumped out at me. Another thing that jumped out at me was that, you know, GPs have to be, God, they have to be so knowledgeable, because they see pregnant women, they see babies, they see children, they see elderly people, they see people who've got cancer, people who've got dementia, people who've got mental health, people who've got social problems. So, you know, how amazing that a GP has to have all of that knowledge. And I was very impressed when I was watching the GP. And then you can also say, well, you know, while I was watching the surgery or the emergency medicine or whatever, I saw that those specialties, those doctors have to be really knowledgeable about their particular area, because it's a specialty. So I hope that's giving you an idea of how to talk about it when you're reflecting, and what to look out for on these online resources, and to understand that they are as valuable as your face-to-face interactions, okay? Because in everything you do, it's what you take away from it. And the other thing to notice is that, look, in every specialty that a doctor does, who is the center of the world for them? The patient. So whatever specialty you do, you observe that for everybody working in that multidisciplinary team, including the doctor, the patient is the center. They do everything to do the best for the patient. The quality of care they all come together to deliver is to be able to do the best for that patient. And that is why you're becoming a doctor. You are going to have the patient at the center of your universe in your career, in your workplace. Right, so the next one. Right, so the other resource which is really helpful is the Royal College of General Practitioners, and they have got online work experience called Observe GP. And they, you know, they've got these videos with the GPs, with the other people who are involved in primary care. So that's really important. And again, when you watch it, reflect, watch what's happening, watch how the GP is working with other people, and relate it to your own qualities. You know, I saw that on that video, the GP was doing blah, 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 blah. You know, when I was working and helping at the whatever you volunteer with, you can relate it. You can say, well, I've got communication skills because I saw the GP who had really good communication skills. They could talk to kids as well as elderly, as well as middle-aged, as well as young people. And when I was helping out mentoring the younger kids at my school or my college, I gained that. So I have got that ability. Right, I'm just watching the time, 5 minutes left. Okay. So again, I've talked a lot about observing and reflecting. And look, if you can't get any kind of work experience, anything, and you know, you can't get even online stuff, okay, you can reflect on what has gone on around you, okay? You can think about how doctors have been involved in infection control. So what qualities did they have to use there? They had to address a problem. They had to have problem-solving ability. Also, they had to work together with everybody. You know, they had to work together with the people starting from the bottom to the top. They had to work to make sure the cleaners understood how the infection control was in their hands, really, because the cleaning people are the people who maintain that sort of infection control within a hospital or a surgery. They've got to clean properly. They've got to make sure, you know, infection doesn't go from one to the other. So think about these areas. And also the teamwork that, oh my goodness, how do you think we have managed to get a vaccine, and the vaccine being delivered, the vaccine being given to, you know, so much of our population? Doctors have been key in working together to make sure this vaccine is developed, this vaccine is tested, and this vaccine is given to those in need. GP services are now going to deliver vaccines. And if we have to have annual vaccination for COVID, much like flu vaccination, primary care GPs are going to be key in that. So, think about that, and you can write about that in your personal statement, okay? And also, well, I've put here they're collecting information and improving treatment. Of course they are, because when COVID first started, we didn't know exactly what to do with these patients. And as the knowledge increased, doctors worked together, they shared information, they collaborated across the world, not just across this country. And now we have better ways of treating these patients. So look at how amazing the job of a doctor is. You're not just somebody operating, you're not just somebody sitting in your surgery, seeing patient after patient. You are somebody who is changing the world. How amazing, okay? And also you can write about your own experiences, so work experience isn't just in the workplace, it is imbibing everything that is going on around you. And I've mentioned these things before, but in the COVID times, we've all had to look after the vulnerable. We've had to look after people in our own families, perhaps, who are elderly, shielding them, making them understand what is happening, consoling them if they're missing people, and also looking after the mental health of our loved ones, our friends, our family. So all of that you can actually include in your personal statement if you haven't been able to get work experience, because that is your life's experience, which at this time is equally as valuable. Okay, so the resources that I have talked about that are really important, and I do believe that it's key for all of you that you go to the sort of resources that are proven to be correct and that are, I don't know what the word is, but anyway, I'm old and I keep forgetting my words. I'm really sorry, but authentic. So you go to the resources that are authentic, okay? So individual medical school websites are really important because that is the information they want to put out there. Medical Schools Council is an amazing resource, really and truly. You can learn everything about applying to medicine there, from all the different medical schools and their requirements, their entry requirements, to how they use personal statement, how they use UCAT, BMAT, how they, they help you with MMIs, which are the multiple mini interviews or straightforward interviews. Every kind of resource you need to apply is there on the Medical Schools Council website, even help for your teachers and your advisors. And as I mentioned earlier, Brighton and Sussex Medical School is a really good resource. Okay, so now I am very proud. I've finished 1 minute before time. So if there are any questions, you can read out and I'll answer, or you can email me, or I'm available for whatever.
Thanks, Dr. Ahmad, for that excellent talk. I've been writing down just a few. There's a few kind of general topic areas that are coming up regards to work experience. One of them is what age should we start looking at work experience? Is any recommendations on that?
Yeah, I think it's there are some. It's kind of like which comes before the chicken or the egg, because obviously it's really useful to start as young as you can, not when you're 10 or whatever, but 15, 16. But a lot of places don't allow very young people to come and be on their premises because of safeguarding issues now. So the present world, all the workplaces, if they have people less than 18, have to have these safeguarding practices. So I would say that, about 16 is a good time to start looking. It can be, honestly, as I said, your work experience is ideal if you can get a bit of work experience in a hospital or a GP practice or a care home, anything where you will see how vulnerable people are treated, how medical staff or healthcare staff deal with these things. But any kind of work experience is experience of the world where you can relate them to your own qualities.
Yes, thanks for that. Also, from my own experience, because we have work experience placements in our own GP practice for students that live in Rosendale in our local schools. We don't tend to take students under the age of 16. It's not just a safeguarding. There's also insurance and employers' issues there as well. So from the age of 16 onwards, you can try, hopefully, local practices and local hospitals. Hopefully after the pandemic is over, we'll kind of go to some kind of degree of normality with that.
And can I just add, I mean, obviously, young people below the age of 18 will be at school, will be at college. So you can actually mentor younger people, and that is work experience. So that kind of ability to improve your communication skills, to understand if they've got problems. So I know that, a lot of schools have this older kids mentoring the younger kids. And I think that's an ideal starting point where you don't have to wait till you're of a certain age.
And there's some mention here about, do we need to do a CV? I know some medical schools after the UCAS application will ask for supplementary information, which isn't really a CV, but it may ask to reflect on certain aspects of your work experience. Is there any views on that, Dr. Ahmad?
I know that I don't know about all of the other ones, but because we kind of liaise with Keele a lot. I know that Keele do something called roles and responsibilities form, and that is so that they can put a structure to everybody who's done work experience. So it's a kind of way of assessing lots of different types of work experience in a standardized way. So they have this roles and responsibilities form that they will send to their applicants after they receive the applications. And they then score according to, the minimum number of hours you've done, the type of work you've done, and that kind of thing. But I don't know if they will still do it in the same way with COVID, because I know that some of that was related to how long you did, if you worked in a care home, how long have you worked there? Because the length of time that you've done a work experience is also a reflection of your commitment. So, if you've been working at a care home for a year, it shows commitment. So it shows that you kind of keep to something once you commit to it.
Okay. All right. I think we've got lots and lots of questions, but as always, we never have time for all of these. I'd just like to thank Dr. Ahmad for an excellent session on work experience. I hope everybody's found that useful. Again, I hope you've all been taking notes. Again, Dr. Ahmad, there's lots of things you mentioned about reflection, empathy, and teamwork. These are topics that you need to get your head around, because they will come up in interviews, and they will also come up in your UCAT exam in the situational judgment. So once again, Dr. Ahmad, thanks. Absolute honor to have you with us.
Don't keep saying that. It's my honor. Oh, it's honestly an absolute pleasure. Thank you so much for inviting me.
All right. Thanks, Dr. Ahmad.
Bum